Thank you very much, Kristen, for having me and organizing and sharing your story, which um, is powerful. And I think it's a good time to have this conversation. All of us members of Congress are back home, out of the DC bubble and on the ground. And I think the bus tour you guys did is so important. I was saying that earlier. And anybody who's actually listening to their constituents, which unfortunately most Republicans are not right now because they're not even willing to hold town halls, but anybody willing to listen to their constituents and to the American people knows that it's very clear what's happening on the ground. This trend was already headed in this direction before this big ugly bill, which I have called the big ugly betrayal. And now to be home and start to see the effects of these cuts come into place, it's heart wrenching. And stories like yours, Kristen, are happening across my district and across the country. So I just wanted to share a few thoughts on that. At the end of the day, I think there's two components here that we need to be talking about: care and cost. They're obviously interrelated, but thought about differently. First and fundamentally, I know this whole coalition just deeply, firmly believes it is fundamentally American to have great, not okay, not decent, but great healthcare that we can actually afford. And that should not be something we ever settle for. And then that brings in the cost piece. And so far, where we're primarily seeing the pressure in the system, of course, access remains hard, but cost is what is just absolutely crushing folks right now, just like you shared in your family. And I think it's so important at this moment, especially while we're back home and both listening to, but being held accountable by our constituents, that folks across the country understand if action is not taken, tens of millions of Americans will see their cost for healthcare skyrocket because of the direction set by President Trump, by the Republican majority in both the House and the Senate. But it's not too late if we rally, as I know this coalition is doing, to stop this and to get this back under control. I know, the perspective I want to bring quickly is that it's easy to get stuck in, especially that sort of at the national level, the big macro numbers, which can almost seem essentially too big to comprehend. I mean, $1 trillion, over $1 trillion in cuts to a fundamental component of our healthcare system, Medicaid, which especially in New York and in my state and in our district is going to be devastating. And just last week, we actually saw the beginning effects of this as the state had to announce that almost 20,000 people in my district are going to lose access to the New York State Essential Plan, which is our Medicaid backed plan. And that's just the tip of the iceberg, unfortunately, in anticipation of what's coming. The other big number that's certainly impossible for me to comprehend is trillions of dollars in tax breaks for the ultra wealthy and big corporations. So I know we all know this on the call, but when I'm talking to constituents, what I remind them is the Republicans are fully in charge, and they just made a choice to give more tax breaks to billionaires and big corporations at the expense of all of our healthcare, both access, but particularly cost. And at the local level in my district, I just wanted to share one example of how that plays out. Folks sitting around a kitchen table in the Hudson Valley, north of New York City, a 60-year-old couple earning $80,000 a year household, which is about the median household income in my district. Because of the actions already taken, they will see their annual premium go up $940, which is a 162% increase just from last year. I mean, that is just fundamentally, sorry, somebody's waving to me in my office here. That is fundamentally wrong and fundamentally un-American. And I know as people hear about this, they're going to be righteously indignant and pushing back, which is why this coalition is so important. So I'll just wrap by saying that it is on us in the coming days and weeks and months to make sure that this message gets out, to just share the facts. There's no need to unfortunately apply any spin here because the numbers are devastating. And for folks in my district and across the country having that conversation at the kitchen table, we need to be their advocate and their ally. The reason I feel optimistic, I'll end with this, is we are, despite how it feels at some moments, we are very much still in a democracy. And in a democracy, when you are with the people, on the side of the people, you win. And we are on the side of the people who believe that healthcare costs should be coming down, not going up. The tax break should be going to the middle class and the working class, not the ultra rich and big corporations. So as long as we continue to strongly, forcefully articulate that, I believe we can, in this moment, win that battle and send a message that with all the harm being done, if we fight strongly on this point, on the point of healthcare affordability specifically, that we can win this battle and send a broader message of all the harms and overreach of the Trump administration. So thank you again for having me. Thanks to all the partners and allies here on this call and across the country, and looking forward to hearing from everybody else.